there, my name's Allison Schmolt and Maria Kantarovic is my group partner, and we did our case study on hysterectomy. A little introduction to hysterectomy. So about 600,000 women have hysterectomies annually in the United States. Of those 600,000 women, 9 out of 10 of them are medically unnecessary or elective. So by age 60, approximately 37% of women have undergone hysterectomies. Hysterectomy is the second most commonly performed women's surgery, second to cesarean section. And every 10 minutes, about 12 hysterectomies are performed. So we're moving on, talking about our case study. So we have Mrs. H. She's a 65-year-old white female. Her history says that she has had no children. She has a fairly active lifestyle. She exercises occasionally, plays golf a couple times a week. She is postmenopausal. She has type 2 diabetes. She had her last gynecological exam approximately 2 years ago. She did inform us that she was a previous light smoker, and she quit about 30 years ago. And she's had no major medical problems that she's been aware of until now. So continuing on with the case study, we're going to give a little history and background into Miss H. So like I said before, she's a 65-year-old female. She says that despite being just slightly overweight, she's always felt relatively healthy. She does exercise occasionally, like I said, and she does play golf a couple times a week. Even though she does exercise, she really doesn't maintain a healthy eating lifestyle. She still maintains eating habits that are high in fat and low in fiber. She's a type 2 diabetic that takes oral medication to combat the diabetes. She hasn't had to have insulin therapy yet. So she does check her blood sugar pretty regularly, and the oral medication seems to be combating the diabetes. So over the past several months, she's noticed that she's had some intermittent vaginal bleeding, but it seems to have, come and gone, and she wasn't very concerned about it, knowing that she was postmenopausal, and sometimes that can be just a regular thing with being postmenopausal. But she started to notice that she has begun to lose some weight, and she hasn't been trying to lose any weight. So along with losing that weight that she's not trying to do, she's also noticed that she's become a little bit more weak and fatigued. So she thought, well, maybe she was feeling that way because of her age. She is 65. But then she started having persistent vaginal bleeding that hasn't stopped. And that started about a week ago. And she's also noticed that she's had some pain while urinating and some pelvic pain as well. So she finally contacted her primary care physician, who was unable to get her in quickly. So they did advise her to go ahead and go into the emergency department. So that's where we'll start. So the patient comes into the emergency room, and she has her chief complaints of abnormal vaginal bleeding, pelvic pain, pain while urinating, fatigue, weakness, and she did give us a list of her home medications, which included the glucophage or metformin. She does take a baby aspirin daily. She does take hormone replacement therapy, which is that estrogen, progesterone, and progestin. And she also takes Zoloft. So the physician's going to go ahead and order a complete blood count, or CBC. He's going to order a pelvic exam, a pelvic ultrasound, a transvaginal ultrasound, and they're going to go ahead and order her some pain relief. He's going to order her Percocet 5-325, as well as ibuprofen. So we're going to look at stage 1. This is her initial assessment when she comes into the emergency room. Her vital signs are stable. Her blood pressure shows 105/65. Her respirations are 16 breaths per minute, heart rate of 86 beats per minute. Her oxygen saturation level is 97%, and she is afebrile with a temperature of 98.9. Upon examination, she is positive for active vaginal bleeding. She does not show any vaginal lesions or lesions anywhere in the pelvic region, and she is not positive for lymph nodes or nodules upon palpation of the pelvic region. So the nursing interventions include, we're going to go ahead and admit her to the to the hospital, and we're going to get her some pain relief. Her CBC showed that her hemoglobin level was 6.6, so those results have been reported to the doctor. And her pelvic ultrasound and transvaginal ultrasound revealed that she does have some thickening of the endometrial lining. Those results were reported to the doctor as well, and he's gone ahead and ordered a CA-125 blood test as well as a CT of the abdomen and pelvic region. So here we go, some questions for stage 1. What do you think the assumed diagnosis could be for Mrs. H given the tests and blood work that she's been undergoing? Secondly, what are some reasons that this patient could be having this ongoing bleeding? And what can you anticipate the treatment or treatments being given Mrs. H's ongoing bleeding? So for the first one, with the CA-125 blood test being ordered, endometrial biopsy, abdominal and pelvic CT scan, we can assume that a probable diagnosis of ovarian or uterine cancer could be suspected. Postmenopausal bleeding can be an indication of several things: uterine fibroids, vaginal atrophy, ovarian or endometrial cancer, and an undiagnosed tumor. So lastly, what is a treatment or treatments that can be anticipated given the workup that Miss H has had and the ongoing bleeding? So given that her CBC or hemoglobin level was 6.6, we can anticipate that the doctor is going to go ahead and order a blood transfusion. And waiting on the results of the CT and CA-125 blood tests, we can suspect that they will do a hysterectomy. And I'm going to go ahead and turn it over to Maria Kantarovic, and she's going to pick up with stage 2. Thank you.